My name is Unos Piwo, the founder of the Neurodivergent Gift, and in partnership with Autism Society in this month of April, it being Autism Awareness Month, we've embarked on a couple conversations with a couple professionals to really help us as parents and caregivers of kids with autism. And part of the conversations that we've had, we've spoken to a couple of speech therapists, we've spoken to a couple of educators, and today we're going to have a conversation with Dr. Danka, who is a dentist, who's my son's dentist. And I know that when it comes to medical services that we seek out for our children, the things that we have to get done, that we can't avoid, it is kind of daunting because we're not quite sure what is it that we should be thinking about doing. We're not sure if they're going to receive us well when we get into the practices. And we all know our kids, and we're not quite sure how are they going to respond to the environment, the sterile environment that we tend to go into, whether it's the dentist, whether it's the doctor, or anything else that we need to do with our kids. So today I'm going to have a chat with Dr. Danka, who's really going to help us just as parents understand what should we be thinking about when it comes to the space of dentistry, when it comes to our kids coming through. I mean, the moment these teeth start going in there, when we have to start brushing their teeth, we have to bring them in. At some point, they need to understand that every 6 months, this is going to be an actual practice for us. And then also, after every 6 months, if something happens along the way, do I need fillings? Do I need X, Y, Z? Cleaning? This is a space that is part of our livelihood. So I'm going to jump straight to the conversation. Doctor, thank you for agreeing to have this chat with me and just really sharing your insights on how we can navigate this space as parents and caregivers. But before we get jumping on all the meat of the conversation, who is Dr. Danka? How long have you been doing this? And why do you wake up every morning and still do this?
Okay, thanks for having me on your show. I really appreciate doing this whole thing with you. Look, I'm just a simple dentist, straightforward, nothing special about me. Right? Graduated at WITS in '98 and been practicing ever since then. So it's about 20 odd years that I'm now in practice. There's nothing special in our sort of qualifications that make us, head and shoulders above everybody else in terms of our academic achievements. It's merely based on, I think the secret is about how we deal with every patient individually. And that's what I think separates the dentists or my colleagues from each other, in that how we approach our patients. So it's not just about special needs kids, or every patient is a special needs patient.
Mm-hmm.
You're not going to get two people walking in here that want the same sort of thing.
Yeah.
So from that background, look, there's nothing special. I mean, we treat all our patients the same way. It's just a matter of understanding, when that patient walks through the front door, what is his needs. So everybody has special needs, right? You'll have that, your kid has it, everybody will have it. So it's how we sort of approach them there. And I think that's what makes the difference in it. In terms of my qualification, look, I've been at WITS, I've done a postgrad through Stellenbosch as well, but it's all basic stuff that, every dentist can sort of put up an accolade and say, listen, this is what it is. There's no special marketing around that. There's no special qualification that we need for this year. It's just your humanity and how you sort of deal with each patient individually that makes you stand out from somebody else there, right? So there, from the start, I'll tell you, it's a simple thing. I'm a dentist, full stop. That's it, right? And how we approach our patients. So you're going to find you build relationships with your patients as you're going on. And I think that's the key to it, is how you build relationships, their confidence in you. And look, things go wrong with all of us. All dentists will have at some point in their career something that has not gone according to treatment. Patients accept and work around that if they are confident in you and they're happy with you and they have trust in you. And that's the most important thing. And when you have that sort of relationship, then it's a win-win, because they're accepting of what you can offer. We human, we have our limitations in what we can offer as professionals. And nobody gets up in the morning to say, I'm going to go and hurt that patient. Everybody gets up in the morning. Every dentist will get up with a mission of, how can I improve or help or assist this person in his dental need, right? Yeah. So in terms of what motivates me is, look, I have a passion for what I do. I like what I do. And I think that's the most important thing when you choose your career, is that, if it's something that you have a passion in, you're going to get up in the morning and go to work in a positive self. Our environment, unfortunately, is where we get a lot of patients. Most patients come in with a lot of negativity around them because it's a painful thing that they're coming in with it. It's how we deal with it, how we turn it around and make it a positive experience that makes a difference for them. So for every individual, it's that, whether it's a normal adult coming in, he's got a toothache, he needs a root treatment, he's sore, he's not coming in a happy mood, he's not coming to have a cup of coffee and be happy with me, So they see us in sort of that light. It's how we deal with it and turn that into a positive experience for them. So what motivates me, I think, is just being able to help people and being there the next, coming to work the day and understanding that God has given us a gift and blessed us with this ability to help people. And if you can do that and the person walks out of here in a happy, sort of better position than they came in, you've achieved something, and that gives you some sort of pleasure and some sort of satisfaction.
Yeah.
I think that's what motivates us.
Yeah. You mentioned two things which I want to highlight. You mentioned humanity. There's a human aspect within you that wants to actually get up, and then there's the passion part. The passion part for it, because in the conversations that I've had, it's one of the things that everyone has said is that because I'm working with humans, I have to want to do this every single day. I have to get up. So I think that's the thing for me, which is so important, especially when I think of us being parents of kids with special needs, is that in seeing that someone firstly wants to be here means it's one extra step. So they're not just ticking a box, they're not gonna pull out the tooth just because the tooth has to be pulled out, but there is a heart behind it. And the part which I want to tap in on is when you spoke about the humanity aspect. What in your humanity said to you, I'm going to figure out how my practice is going to be open to people and kids with special needs? Was there something that just clicked within you when you were looking around your world and how you wanted your practice to be different? Was there something that triggered it? Because you could have, no, we don't do that here, but you've opened up your doors to it.
No, I don't think it's a special thing of, something that clicked in me or triggered in it. I just realized from early in my career that, every patient of mine is a special needs patient.
Okay.
Nobody's going to come in here just because, they want to come and say hello. Whether he's coming in just for a checkup, just for a simple scale and polish cleanup, which the hygienist would do, or he's coming in for major surgical work or so. Yeah. Everyone has a special need. And what we got to identify as medical professionals is that everybody has a character. They come with a bag full of experiences when they come here, and some of them are positive, some are negative experiences that they've had. And we got to sort of respect, understand, and appreciate that they're coming in here with some apprehension and some sort of hope that we'll overcome that. And if we just take 2 steps back and take the time to see that person as a human that is coming with all the sort of emotions and feelings and has the psychology that's involved in it, and if we can respect that and sort of work with that, then I think we can achieve that. So there hasn't been a turning point in my career or a switched on that said, listen, special need kids, change my approach to that. I can't have a different approach for that kid to anybody else, because they all have needs. It's just that some people it's a little more sensitive or directed in a certain way, right? I would get a professor coming from a university to me, or somebody that's highly intellectual coming in here and expecting treatment done, or you will have a businessman or a CEO that's coming in who's tight on time and needs certain things done, and he's sort of here would tick the boxes, get these things done and does that. That person, I know I can get down straight to the dental side and treat them. Yeah. You're going to get a special needs kid that will come in here. That is part of that's what our goal is, to achieve that. But to get to that, we need to first understand this kid, make that kid comfortable, get into his world, be part of his world before he'll sort of become part of your world and allow you to do treatment on him. Okay. So it's not a thing. I mean, if you walk through my practice, yes, we keep a little extra things for these kids that will entertain them and sort of make them feel a little bit more at home in the practice. But by and far, it's the same environment that CEO will come and sit in and be comfortable in.
Yes.
So that's where the humanity comes in, is that you're not just treating a tooth and ticking the box and getting that done and earning a reward for doing that.
Yes.
It's about that person that's coming in here and understanding and dealing with him as a person and understanding his emotions, his fears, what he wants. Work at his pace. Come down to his level, look in his eyes at his level, and then work with him.
Yeah.
And I find that that's the secret where kids will then take to you and open up. I mean, when your son came in here, he came with a history, for example, of being to so many other dentists, and probably he's been rushed through the process. And not that they've done anything wrong in terms of the medical treatment that he was afforded.
Yes.
It's not about that. It's about identifying with him, understanding him, let him sort of take to you, trust you, and once you build that confidence in that patient, then you can do anything on that kid and he'll allow you to do. So if you noticed, I mean, when your son came in, the first thing I did is I met him at the door. I brought him into my waiting area. We sat and we had a conversation here until a point where he actually held on to me and started conversing further. Normally the special kid needs have the sensory thing where they won't allow you into their space. Here, he actually opened his space and sort of hugged me or brought me into his space. That's when I knew, okay, now we're ready to go into the dental field of it, and then I took him into the surgery. So we sort of overcame the barrier right in the start. So if I had done it the other way around, and my reception had seen him here and sort of done the paperwork here with him, and you had brought him straight in there with my gown on and my gloves on and mask and all that, he would have been apprehensive and in a different mode of sort of, because he would have gone into a different zone. There isn't a special thing of, we need to be trained, and we just need to have that little bit of humanity in us to say, listen, just comfort the patient first. And unfortunately, the problem that we as professionals have is that, we have a limited amount of time we can offer our services to patients. We have a big number of patients that will want to come in that time. So we sort of constrained on our time, and we try and work on a budget of time and say, listen, 15 minutes or half an hour per patient, and if you're running out of that time, then it's a problem. Because the next patient's already there. So if we sort of put the brakes on and just sort of ease off that, and if you ask me, okay, what's special about my practice, then maybe that's what's special, is that we take time to have conversations with patients and to calm them and settle them down before we start working. That's where it makes it different. My staff sometimes get annoyed with me that, you spend too much time talking.
Too much time.
You're taking too much time, and get down and get the work done. But that's part of the work. Is to make that patient comfortable and ease, because it makes your work easier. I don't know if that answers what
it does, because that was one of the things I remember when we were sitting then in your actual room, and I was looking at how you were engaging with my boys. So time definitely is something that you offered us, which was one of the big factors that played in. Like you said, there was time that was spent sitting in the reception area where you were just talking to him, and you were also talking to me because you were also getting the history. You were doing that process that normally a receptionist would have done, but you were doing it with me instead of reading it from a file. So from a parent's point of view, knowing that you even gave me the time to get the history and not necessarily through the surgical process of the actual receptionist doing it, writing it down, and you just reading it in there. So that, number one, for me was one of the things which I truly appreciated, is that I got the time, my son got the time. And then when he then was happy with you, because like you said, he moved in closer to you, and then you were able to walk to your actual rooms, and you asked do you want to hold my hand? And he said yes, and that was obviously that first note of he's okay with that. And then when we got inside, then it was, you gave him a tour. You were just like, and this is the chair, and these are the lights. Do you want to play with the lights? And do you want to play with the chair? So those are the things for me which truly made the difference, and gave me a sense of peace as a mom, that this visit was going to be led by my son and not necessarily led by me, who knows what he needs to come and do here, or by you as the professional, like you say, because you're on a clock. And so for me, that was the difference. That truly was the difference. And we walked out of that session. The only thing you did was polish his teeth. Because it was you gave him a mirror. He could see his own teeth. You took pictures, obviously. He took his own pictures of the tooth. You were counting the teeth. And so those are the things for me which is why then afterwards I then sent my note to my mom group on some, please, you need to go and go and see this doctor because the way he just treated me. But I want to go right back to the beginning of when I'm looking for a dentist. Because you are a dentist who's consciously made the decision that everyone who comes in here is going to be given the time, is going to be given patience, and we are going to treat them special with what they've walked in here with.
Correct.
So as a mom, so if we hone in on special needs kids, what questions should I be asking myself in looking for a dentist? So what should I be asking myself, and what should I ask as I'm looking around? What should I be asking to know, okay, this is let me go try that person. Yeah.
Okay, so let me put it out there right in the start as a being is that, look, most of my colleagues, we sort of qualified at the same sort of universities, come out with the same sort of degrees, have had the same sort of exposure and experience when we've come out with our clinical skills. Some of us have honed it a little further, done a little bit of extra sort of courses on the side or so. But at the end of the day, our clinical abilities, I think, I would say most of us are on par. There'll be a few that will maybe a little bit ahead of that, but that is one side of it.
Yeah.
Right? The more important thing for me is, how does that doctor deal with his patients, and how does he see his patient? Does he see him as a number and it's just coming and need to do so many patients a day to make my sort of profitability or my turnover? Do they see you as a number, or do they see you as a human that's coming in here with an issue and I need to deal? Now, unfortunately, the downside for us is that we have sort of pressures on our side. We've got overheads to meet, we've got debts to pay, all that, and we sit down sometimes and we look at the maths behind it and say, listen, this is what we need to do, and this is how we become profitable, and so on. And that is where the problem comes in, is that because of those sort of pressures, right, there's then a difference, and this is where then we start seeing differences in colleagues and in terms of different practices. Is that some people will fall into that trap and say, okay, I need to see 20 patients a day, I need to spend 10 minutes on a patient, and that's where I'm profitable, or I'm making money. Right? And others will say, listen, that's not who I am. I want to spend time with my patient, I want to know who my patient is. It's almost like I'm sitting and having a cup of coffee with them, and I'm having this experience. And yes, my overheads are X, but unfortunately, to offer that sort of service, it's going to cost me more per head or per patient. And that's where the difference comes in. So as a parent, when you're looking to say, listen, who's the dentist I need to go and see, or my kid will be in the special need that will be comfortable going to, that is a big criteria, is to ask yourself, is this dentist somebody that's got the time to spend with my kid? And if we're running out of time, will he sort of budget more time to sort of continue with the treatment, or is he going to just sort of put the kid down and get his objective done? Look, whether I do the filling or my colleague does the filling, the probabilities that the filling is the same. It's how we achieve that goal, and how do we get the kid to sort of go through the whole process, right? So when you're asking me, listen, what's the first steps I'm going to look for, is look for a dentist that's got the time to sit down and discuss with you and understand who you are, who your kid is, what your needs are, what your kid's need is, and can he fulfill that for you first? Right? I myself, like, if I can use my practice as an example, is that I try not to have sort of a volume of patients through the door as a sausage factory would work, I try and sort of have spaces between them and have longer appointments. I rather have a 15-minute, 20-minute break between patients and sit and do something else in that time than to be running back to back, and then now I'm pressurized because my next two patients are waiting, and this kid doesn't want to cooperate, and that's where things start going wrong. So I think the most important thing is to look for that patient, that doctor that's going to be sort of empathetic and sensitive towards what your kid's needs are, and give you the time of day. When you use the example earlier that I sat and I spoke to you here in front as well, and look, for me, I was doing my work here already, because by me sitting here in front at reception and talking to you and to yourself, it was already giving me feedback of what your expectations are, how well sort of in tune are you with the situation and what your kids' needs are, it gave me a lot of background on that part of it. Now, sometimes you're going to get a parent coming in here with a special needs, a kid that walked out here early.
Yes,
right?
yes.
The dad came in the week. They've got 2 kids that are sort of
Okay.
special needs. I'm actually taking the other kid to theatre now
Okay.
in the next week, right? But the dad came in on that day because the mom couldn't make it.
Yes.
He was here, and because I've got a history with the kids already, I know the background to that.
Yes.
He came in, he was like sort of not involved in the whole thing. He came in, he was more almost as an au pair, like bringing the kid in and taking the kid home.
Yeah.
So he was more the Uber
Yes.
in the whole thing. So we were supposed to take this kid, or we need to take this kid into theatre.
Yeah.
Right? And I gave him all a rundown of what needs to be done, all that. When the mom came in today, she's telling us that he doesn't come home with messages. So we need to now start again. So it's important in that reception that you understand, what the background, what the expectations are. So like if I had to take the 2 parents as examples here, right? You got 2 different sort of situations.
Yes.
You on top of what you're doing, I know what your expectations are. I know how clued up you are on it. So obviously when I'm dealing with you, I'm dealing with a different personality to somebody who's laid back, and so you got to take on different response. I know in your scenario, your kid, you're going to take on a lot of the responsibility yourself of looking after the maintenance.
Yes.
With the other scenario, I need to take on a lot of that responsibility because I know, the message is not going to get home.
Yes.
The caregiving at home might not be able to. Now I know the mom is, more hands-on there.
Yes.
So I need to make sure that at some point I have that communication with the mom.
Okay.
I knew she's coming in today with the second kid.
Yeah.
So I had to budget time today. I made time to discuss the first kid's situation with her. So I know that this is, because unfortunately dental treatment doesn't happen in a static environment because you don't leave your tooth behind here when you go. Right? Somebody needs to take care of that tooth at home.
Yes.
So having this discussion with her afterwards, or today, helps me to make sure that we have a successful treatment on it. Okay. So when you ask me about, how do I find my dentist, that's what you're looking for as a start off point. You said, is this person dedicated enough and sort of buys into this thing of giving me time and my kid time in that time. If I have to after hours or afterwards get hold of him to ask him, listen, things can go wrong. This is what happened. Are they there for me?
Yeah.
That's the most important thing. Is that doctor there? Look, the dental treatment, unfortunately, in our profession, we sort of leading towards that where marketing is becoming a big thing. So social media becomes a big sort of thing of attracting patients, and we put up a lot of fancy adverts and of how our practices are and so on. And all that is just smoke screens. In where we're going, you need to know your professional. Is he dedicated to you? Is he dedicated to your kid? Is he going to be there for you when you need him on that odd hour or so? Yeah. And I think that's your start-off point.
Okay.
And I tend to sort of, I'm inclined more to say that, in these sort of special needs kids, you need to find a practice that's not running a sausage factory type of situation because you need the extra time with your kid. And that's the reality of it.
Yeah.
So,
I think just to touch on what you're saying around the marketing and the social media, I also had another conversation with educators where they said, no school is going to say we're subpar, we don't take care. So the same thing as you say,
exactly.
Even with the dentist, everyone's going to advertise the same things, but it's the responsibility of the caregivers and the parents to ask the questions, to ask, is there time? How do you treat this? Because I remember when I was looking, because I was frustrated, I was really frustrated because I knew I didn't want to take him back to where we had come from, and I was looking for a different dentist. I remember sending a message on my mom's group, do you guys know dentists? Where are you taking your kids? And all the responses were so far, and I was just like, that's too far for me to actually drive. There has to be a dentist around me. And then I put it on ChatGPT. I said, ChatGPT, my child is autistic. I'm looking for a dentist who's going to manage, and what are the reviews? Because obviously it all comes down to the reviews also, which is why it is so important to leave reviews so that it helps us to find the dentist. And then your name came up, and then I remember I sent an email through because I think it must have been before we even opened in January, so we were still in that Christmas break.
Correct.
And I remember sending an email because I was like, I know that they're closed, and I think you were only opening like a week or two later. I remember sending that email, and I was very clear in there that my child is autistic. Therefore, I'm looking for 1, 2, 3, 4, 5. Do you guys do this? And you responded on your holiday. You responded, but obviously the response said we only open in 2 weeks' time. But already that was that thing. So I think that, like you're saying, it's very important to ask the questions. Ask the questions and share the information, because you can't help me if I only give you half the information. And then when we get in there and my child starts acting up, and then you throw it off course.
Yeah,
also.
no, that's true. That's true. So look, on that, the thing is, as much as the Google reviews and all that help, and sort of it's important to have that day in place, I will still emphasize, it's a one-on-one. Do you click with that professional, that medical professional that you see? As a parent, you're gonna walk in, and in the first 5 minutes, you can sum up, how your personalities,
Yes.
I've had incidences, and I'll be the first to say it, we have had patients come in here, and back of my mind after that, I'm hoping, they go elsewhere, because they're just it's just so polarized in terms of you treating, that that we're not meant for each other.
Yeah.
So that's important to also find that I'll tell you straight, I'm not the dentist for every person you're going to get certain personalities that will come in here and say, listen, I don't want to have a conversation with you.
Yeah.
I'm not here for this. I'm here to have a filling done, get my job done, and let me go.
Yeah.
Right? And then you're going to get those that will come in here and they want to talk about, what the pet has done, or what's happened to his dog at home, and the neighbor's incidents. And then some of them come in here. I had an elderly lady yesterday here, in her 80s, right? And she came in just for a checkup. But she spent more than half an hour telling him about her bad experience she had, and she had her operator. So she just came in here and she vented about this is what's happened to her, and I sat and I was sympathetic, and we listened to her whole experience and sympathized with her on the whole thing. And she had her checkup done in the process, and she was fine. There was nothing more I could do for her, but she came to the dentist to come and vent about her experience. Now, sometimes you're going to say, but listen, I'm not your psychologist, I'm not your psychiatrist, go that's it.
Yeah.
But that's why I'm saying part of it, you got to click and you got to see that in that first experience with your dentist. Don't rush treatment, is what I'll advise. You know what? Go to the dentist for the first visit, make it a contact visit as a meet and greet experience. Yes. That's how I try and do all my kids, all my special need kids. My first appointment is more, all I want to achieve in that is a meet and greet. Yes. Even if a lot of them, I don't even take them into my surgery. I mean, we'll meet and we'll have a conversation in the waiting room, and then we'll probably go and play on a jungle gym outside for a while, and bye-bye, and I'll see you next time. And the next time you come in, the kid's already familiar with the environment, and then we take it to the next step. Yes. So that's what I'm saying, we're sometimes too pressurized to get the work done.
Okay.
So
from a parent's point of view, so you're talking about the dentist being pressurized, and some practices are set up that way. From a parent's point of view, what should I also let go of to allow this process to go as smoothly as possible?
All right. So the few things that are, on the other side of the table would be then, as a parent, obviously when you're coming or you're looking for this sort of value in treatment, then you've got to understand, unfortunately, one of the big downsides are you are dictated to by financial constraints in terms of what your medical aid is going to afford you, what they're going to pay for, what they're not going to pay for, that sort of thing. Unfortunately, when you're looking for this sort of scenario, then you got to let go of the fact that maybe your professional that's going to see you might not be sort of charging you at the same rates that what you're going to be accustomed to, and what your medical aid is going to cover you and stuff. So that's unfortunately, look, it is what it is. That's the reality of life. That I afford you maybe an hour of time as opposed to 20 minutes of my time, right? Because I would see three other at a different cost because there's an overhead cost. So sometimes it costs a little, and I find that to be a big factor in practice. My side personally, look, I'm sympathetic towards it, and we weigh each case individually. Sometimes it's not always about money. So I had a case this morning that a patient walked in here, chipped a tooth, has been seeing another dentist, broke the tooth. Her dentist is not available to see her. Although he's there, he's not wanting to see her because it's not lucrative for him to do that.
Yeah.
Through the grapevine, her family, she's friends with a family that comes to me.
Yes.
And they tell her, go and see this guy. And she came in here, and I could see she's got a financial constraint. And
Yes.
we helped her out pro bono, and we just sort of did that. And she was appreciative. She walked out of here, and I know that's a marketing for me.
Yes.
Right? But at the same time, you know, you got to be compassionate about that. So
Yes.
as much as financial thing is a stuff, I think as a parent, you got to understand from the beginning that yes, that's one. Number two is that sometimes parents themselves are too time strung, you know, in that they've got, you know, things to do, places to be,
Yes.
goals to achieve.
Yeah.
And this is like dragging on forever. And you got to appreciate that, you know what, we've got to work at your kid's pace. Right? I can't do 10 fillings for you today because the child is not in a mood to even let me see. So I'm gonna not do that.
Yes.
I'm not gonna force the kid through. So you gotta appreciate that part of it. And I think those are the main things that I think that will affect your team. Look, at the end of the day, as a parent, you want the best outcome for your kid.
Yes.
I, as a dentist, want the best outcome for your kid. So we both have a common goal there already.
Yeah.
It's how we achieve it.
Yeah.
And I think the hurdles you need to overcome. One is the time that we require.
Yes.
I need to give that time. You need to sacrifice from your side and sort of come in at the times. The other thing I tend to do always is I make sure that, you know, if I'm seeing a special needs kid, I'm not seeing them in my peak hour of work, because
Yes.
I tell my receptionist that, you know what, book this child in when the surgery is not that busy, so they're more comfortable not having 10 people sitting around them and, you know, that sort of thing. It becomes more a homely environment.
Yes.
So from my side, I clear my diary out around that. So to make sure that, you know, if the kid is coming to see me at, sort of, I see them before lunch, knowing that, okay, I've got a lunch hour that we can run into, maybe a patient ahead of that we sort of clear out, so that we've got time to sit, and if we need the time, we've got the time.
Yes.
So that's the time that I would give. As a parent on your side, you know, sometimes you're on a clock. You know, you bring your kid here for a half an hour appointment and things are not running on time, and you've got to be in a meeting or somewhere else, and now you start becoming edgy. You've got to accept that, you know, this is how it is.
Yeah.
Right? So those are, I think, the things what you would look for from your side, and that's sort of what you need to also compromise on and understand that, you know, it comes at a cost and it comes at some sacrifice in terms of your dedication. The other thing that I find also happens is that a lot of times parents don't want to take responsibility for sort of the back of house or behind, you know, the aftercare that happens. So understand, as a dentist, you're only in control of the environment or that kid while he's sitting on the chair. When he goes home, you know, his diet, his oral hygiene, who's taking care of all of that. Somebody needs to take responsibility, and you can't buy that. You know, sometimes parents come with that attitude that, you know what, you're treating my kid, you know, I'm paying X amount for this year, problem is supposed to be solved. It doesn't work that way. You know, as much as we do that, you got to go home and you got to maintain that.
Yes.
And that comes with effort. You can't buy that sort of treatment for your patient, if I can explain it that way. So, and our lives are all busy. So, you know, sometimes parents are busy also, and they don't have the time, but they got to acknowledge that. You know what, there's a bit of negligence on that side, or it hasn't happened. I'll give you the prior example. The dad hasn't gone home and communicated that, you know what, we need to get the authorizations in order to go to theatre. He's busy. He's now, you know, he's a CEO. He's a big boy. So he doesn't have the time for that. But there's an acknowledgement. I mean, the mom came in and we did acknowledge, you know, he doesn't do that, but I'm going to sort it out. So it kind of helps. It's teamwork in our life. This is teamwork that has to go happen. We're just a small part of it.
Yeah, and that's one of the biggest things that in these conversations that has truly come up, is that there is a team around this child, and that the parent is the advocate, you are the team leader, and then everyone else forms part of the ecosystem. But it's the parent who still needs to keep everything going at the end of the day. And as a parent, also realizing that my child being autistic is not necessarily going to pick up on what he needs to do as easily as a neurotypical child, you know, so there's an extra effort that I need to place in there. And it's just something that I know I'm learning. I know that if I'm not reminding my child that we need to do this, it doesn't happen. Unlike my other boy who loves to do this, who remembers that routine, and it's just like, we haven't done this today. But that there is that effort, and there's it, and you just form part of the team.
Yeah, so our team actually extends beyond that. I mean, it's not just me and you and the kid in the team. I mean, on the dental side, my team includes my receptionist when he walks in and how she greets him, and then my assistant that gives him that reward, because I think it was your kid that asked me what am I going to get after this, and I told him, there's a surprise for you, but Auntie Zizi will tell you about it later, right? So I mean, they get a little toy on the side or so that happens for them there, but she's just as much part of the team, in making it a happy experience for you, because by including her on that and she rewards him with that, there's a bond that's built there. It's beyond just him and I.
Yes.
Going one step further, the other professionals that come in. You're going to have your educational professionals that will come into it. You'll have maybe your psychologists that are involved in the whole treatment planning. He's going to have his OT involved, and a speech therapist. All those people come involved, and we need to sort of work together and appreciate each other's speciality and expertise, and sort of it's teamwork. It's you got to work as a team to give the kid the best that's available. So sometimes it means. I get frustrated a lot of them, not very specific with this. You have other specialists, you call them to find out about patients got a whole medical history of things, and you're calling there and they're just not available to take your call. You leave a message with reception, I need to know about this patient XYZ, can I do this, can't I do this? They just don't get back to you. They've done their treatment from their side, excellent physicians. But just not giving us the feedback that we need, or we not having that communication line is to the detriment of the patient. That's why I say it's an extended teamwork. All that also comes in as a factor. And we've got to be cognizant. I mean, sometimes you're going to get a speech therapist calling to say, listen, I need to know, doc is, ask for this appliance to be fitted, or, in an orthodontic appliance for growth stem, whatever it is that we're using there. But I'm having a challenge because I need to do this, that,
it's going to impact speech by you putting in braces.
Correct. So we got to work those things out together. And it's no use me saying, this kid needs a perfect arch here, so I'm going to put the braces in now. Meanwhile, we've got a more primary issue that's at stake, where the kids maybe speech is affected. So we got to prioritize that, and I've got to acknowledge and say, okay, let's work with your challenge first. Let's get through that, and we'll sort of delay this for a little later. If you don't have that communication, suddenly the kid pitches there, the speech therapist with braces or appliance in the mouth, and it's put her months back in her treatment, and now she's got to now start all over again. So that's where team building is.
I never thought of that. So I understand the team aspect, but I never thought how braces could impact the speech therapy treatment.
I'm just using that as an example.
No, but it is such a good example that because those lines of communication need to be so open between everyone in the team, so that you are able to know, because in my mind, I always said the speech therapist and the teachers have that connection, but it never dawned to me that the dentist
everybody has a connection, whether it's
because we're all impacting the mouth at the end of the day.
Your body is one unit. Doesn't matter what you're going for. I mean, in the elderly, if I use that as an example, I know for a fact that most of them will be seeing physicians, or they've got a cardiologist on board, or somebody that said some medical professional is there. And if I need to do something, I need to know how's that going to impact on what treatment they're getting there. Simple thing, if I have to do an extraction on a patient that's now been on blood thinners or so, I can't just go and take the patient off there, because I'm not sure what the physician or the cardiologist has been doing. So I need to make that call and be there. So one of the things that we obviously do on my side is I always ask the patient, what other medical professionals they're seeing, or what other treatments they're doing, and we keep those contact numbers in the file. Who's your doctor, what's their contact number, and I ask them for it, and sometimes they don't have it and they get irritated, and I say, bring it back for me. Bring it back for me. So knowing that, if I know your kid is now a speech therapist, it's important for me to sort of have that channel available. In your case specifically, it's easy for me because you're so hands-on. You're my go-to person. Sometimes with certain parents, they don't even know who the contact number on the other side. So we need to have that sort of there, so we can sort of give the best overall holistic treatment. So that's what you need to sort of work on.
Thank you for that, noting that. To wrap up our chat, you now have gone many years into this profession and you are passionate about what you do, and you've created an environment which is so open and so welcoming for kids with special needs and their parents. For the dentists that are coming up now behind you, so now you are in the phase where now you are imparting knowledge. You are, if someone asks you for mentorship, you would then be open to yes or no for it, but you're now at that point in your career. Dentists that are coming up and knowing now what you've learned and the humanity aspect of it, what would be the things, if you could give me 2 things that you would say to them, that on how they're able to positively impact every single person that walks through their practice doors?
There's only one thing I want to tell them is that simply, treat every patient as a human and have that humanity to understand that they're coming with baggage, they're coming with experiences, they've got negativities, positive things that have happened in them in the past. Understand, appreciate that, and treat them on that value, right? Unfortunately, what's happening in our stuff is we as professionals are also chasing success, right? And we sort of mark that by how many patients you see, what our turnovers are, and what we do. Success that way, the money and all that will come later. All right, just be human enough to treat the patient well and take the time. Don't rush to climb the ladder.
Yeah.
Right, do it slowly, and I promise you, the rewards are much better than when you're trying to sort of get to the peak within that first year.
Yeah.
We 20 odd years in practice, right?
Yeah.
It takes a long time to get there, but as you see the progress and you see the success of it. So chase the right things, be there, be passionate about what you do, have compassion towards your patients, be empathetic, understand their needs, understand their fears, and work with it. And your practice will just grow from it. It will grow from that. So
thank you, Doc.
Right.
I want to say thank you. I want to say thank you for seeing my anxiety when I walked in through the door, and for giving me what I needed in that moment, which was answers, because I think that's the biggest thing that I actually had. But besides the answers, in how you treated my boy and how your staff also treated your boy, and what that then says is that your humanity and your heart is what has kept this place open and also has made your people also respond in the same way to us. So I want to say thank you. I want to say thank you for being open and doing this for so many years, long enough for me to have a kid and for them to have teeth to have come to this point. And I want to thank God to give you more, more and more, in the sense that everyone that comes in through the door brings in someone else.
Correct.
So that
that's unfortunately that is what our marketing should be.
Yeah.
Unfortunately, and we've diverted from that word of mouth. That's your best marketing, and that's another advice I'll give to new professionals coming through. Is that means more than any social media stuff. Checking on ChatGPT or Google or wherever it is, because the thing is that is a more solid stuff. If you get a referral from somebody who's had a first-hand experience, right, it's of more value, because reviews can be sort of worked around and could be sort of tricked around to get you that 5-star review, right? And that shouldn't be your only criteria for choosing, where the practice. And we shouldn't be chasing that. Rather chase those referrals that come from patients that are saying, good guy to go to, he's compassionate and so on. And I think the other thing we must always remember is that God has given us a skill. He's blessed us with a certain privilege on that, and we owe it to our fellow humans to say, listen, if this is a skill that God has given me, I need to be responsible, and I need to sort of use that to use it well, and and for the right reasons. It's not a skill just given to us to better my own life, my personal capacity, and look at increase my bank balance. There's some sort of give back that we need to give, and yes, your personal rewards will come. That's inevitable. That God will reward you for what you do. If you have the right intention and you work well, and you're delivering service to the best of your ability to mankind, everything else will come. It will fall in place.
Thank you, Doctor.
But I really thank you for having me on your show, and
thank you.